Hi, I'm Dr. Klos. I'm a urologist at drrachelrubin, MD, where we treat a lot of sexual medicine, specifically erectile dysfunction. We're going to talk to you about, for the next few minutes, one of the therapies that we offer here in the office. But first, introducing our wonderful medical assistant.
Hi, I'm Sophie, one of our medical assistants, and I do our shockwave therapy in the office.
So, what is shockwave therapy? Well, I'm going to take you back a little bit. Shockwaves have been around for decades in medicine and been used to treat various conditions. Shockwaves are acoustic waves. Now, don't get scared. Acoustic waves that can be heard by the human ear are actually called sound waves. So, something that we're all really used to. Back to shockwave, because that's why we're here. As a urologist, I'm experienced using shockwave, but in a different fashion. So, high-intensity focused shockwaves have been used for decades again to treat and break up kidney stones. But that's high-intensity focused shockwave. What we're here to talk about today is a low-intensity shockwave. So, low-intensity shockwaves are delivered either in a focused or an unfocused fashion to treat various medical conditions. This is a new and emerging therapy used primarily for vascular conditions. Let's get scientific for a second and find out what low-intensity shockwaves do. So they're thought to trigger a cascade of events: improvement of endothelial progenitor cells, an increase in neovascularization, promotion of angiogenic factors, and a decrease or reduction in demyelinated nerve fibers. What does all of that mean?
Tell me, please.
It means, hopefully, an increase in sensation and, over time, blood flow to the penis. Two things that are essential for good erections. Sophie, how does all of this therapy work? Because you're the one who's here with the patient when they're in the office.
Yeah, so the whole treatment session, we each take about 30 minutes. And so you'll come into the office, you'll be in this lovely room.
Okay, but wait, are they painful?
Okay, no pain. No pain. It's just a little loud.
Okay.
That's it.
All right, so take me back. So we're back here in the room, then what happens?
We're here in the room, you'll get undressed from the waist down, and then we will introduce our machine.
Ooh, can I tell you a little bit about the machine? All right. Urogold machine that we have here in the office is FDA cleared for improving blood supply, treating pain conditions, connective tissue activation, wound healing, and it may help with erectile function.
That's what we're here for. So this is our machine, and we will be...
Let's show a little bit of what it looks like.
Yes. This is what happens.
Not too loud. Okay, show it on my hand. Does this feel like it's gonna hurt? Not at all. Okay, great. So we've got our probe, and that's what we use to deliver the, again, low intensity shock waves. But where do we do it?
Great question.
All right.
So we do a few locations on the penis itself. So I can show you. We go sort of here, 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 and here.
And what this does is this will allow for the shock waves to be delivered to the corporal tissue. So this is really our primary vascular tissue, where blood flow is increased to obtain an erection. And as you can imagine, there are also a lot of nerve fibers along the shaft of the penis. But that's not all of it, right?
Mm-hmm.
Where else do we go?
So then we kind of go under. So over here and on this side and then in the middle too.
Again, that's another area where the pudendal nerve, or one of the main nerves to the penis, runs, and we want to make sure that we're treating that area as well.
That's about it. It's pretty simple.
Again, how long does it last?
25 to 30 minutes.
Okay. Painful or not painful?
Not painful.
All right. And what's the typical protocol of how many treatments do I need over what period of time?
Usually we have people do 6 treatments, and typically once a week, although you could do twice a week.
Great. Success rates. What have patients told you in terms of success?
Patients typically in the beginning see an increase maybe in nighttime erections or morning erections. They might see that their medications like their Cialis or Viagra are working better, that they need less of it. They might notice fuller erections, more frequent erections. That's what people notice.
That's fantastic. Literature tends to back that up. In patients that have erectile dysfunction, primarily vascular in nature, there's about a 60 to 70% success rate. Now that success does vary because there are a lot of factors that can come into play in erectile dysfunction, comorbid medical conditions, medications, any surgical history or trauma. So I wish I could say that was across the board, but it is definitely hopeful for outcomes when patients are undergoing this therapy. Hopefully this was informative for you today and you learned something. If you want more information, please feel free to reach out to our office.
Reach out to us on the portal, or if you're a new patient, email office@drchelrubinmd.com to get on our schedule.